One group of essential workers are having to cope with added stress as the holiday virus surge taxes our country's healthcare system. Caregivers, they are exhausted. In the beginning of the pandemic, there was a lot of attention on the efforts to protect their physical health. News 5's Mike Brookbank found out their mental health is now top of mind.
In a year when it's been hard to keep track of time, there has been one constant for caregivers: heartache.
It's been awful to see them lose their lives and talk to their families and have their families not see them when they die.
Those rising to the challenge to treat patients with coronavirus.
It's hard for it to even escape your mind when this is just all we deal with day in and day out. It really is taking over our lives.
Finding themselves not only in the crosshairs of a devastating disease,
it's emotionally tasking for everyone involved,
but a mental health bullseye.
You take it home. You don't want to, but you do.
For nurses working on Metro Hospital's COVID floor, the tables have turned.
It's really heartbreaking having to watch someone die alone.
I've had to hold an iPad in front of them so their families can see them one less time.
Caregivers finding themselves in need of care.
We've gone through a lot watching these people be very critically ill and die.
While they lean on each other.
That's how I'm getting through it.
We're living this, so it's nice to have a coworker to talk to. It's a lot, especially when you lose a patient.
Frontline workers are seeking help.
Many of them are taught to be stoic in the face of adversity.
Their bosses at Metro Health developing new programs to help.
We cry, we bleed, we hurt just like anybody else. Taking that first step to say, hey, I need help, it's not a natural thing to do.
Trauma thrives in isolation, resilience thrives in connection.
Katie Kurtz provides COVID as trauma training for frontline workers. She tells me demand for her safe space is increasing.
We need to give ourselves permission to be human and to feel through this.
In addition to offering resiliency techniques,
it's okay to ask for help, for support.
Metro Health gives its staff time to divert their attention away from the stress of the workday.
We have book clubs that are virtual. We even have a Spanish club for those who want to learn Spanish.
Doctors like Ted Warren, who work in the intensive care unit.
There's definitely significantly more stress. The challenges come with the frequency with which these patients come in.
Get extra time off after their shifts,
which has made a big difference.
Until this pandemic comes to a close.
As this drags on, this becomes much more difficult and becomes more of a concern.
The nurses at Metro tell me they're going to keep looking out for each other.
You know when someone's at their tipping point, when someone needs a break.
And take advantage of those small moments, like being able to walk outside for an interview with News 5.
The first thing I did was take my mask off and just take a breath of fresh air.
It feels
nice.
great.
Reporting in Cleveland, Mike Brookbank, News 5.
Okay, we want to remind you that if you need it, help is out there. There are a few resources on your screen right now for anybody struggling. You can reach the National Suicide Hotline by calling 800-273-8255. Somebody will pick up 24 hours a day.